Borderline personality disorder. The mere mention of this disorder makes most therapists quiver in their shoes. Of course, personality disorders are notorious for being difficult to treat to begin with because they're so ingrained into a person's makeup. Among the 10 personality disorders, borderline personality disorder definitely ranks among the hardest to treat. Most people going so far as to say that it's impossible to treat. A former professor of mine once made the analogy that a borderline personality disorder patient is very similar to a hurricane. The person themselves are actually at the center, the eye of the hurricane, with all of these emotions and chaotic thoughts twirling around them. So they really want to get out and touch other people, be normal per se, but they can't because of all these just turbulent storm that they're just trapped in the center of. And the same goes true with most people trying to reach them as well. Because of this, treatment of personality disorders, especially BPD here, is very difficult to treat. A few reasons for that for BPD is there's a duality nature to borderline personality disorder. Everything with a BPD patient is black or white. They're very extreme. It's right or wrong, love or hate. There's no shades of gray. There's no middle ground whatsoever. So really, treatment is effective or not at all. They don't give any ground. Next, you have character armor. Personality disorders generally have a character disposition among them. A character armor is something that these people, they build around them, they front, it's what they base their identity on. For a BPD patient, this is the role of the victim. Everyone's out to get them, everything happens to them, they're always the victim among everything, making them very difficult to treat therapy-wise because they don't see any good things. And if something is good, then it's so good they strangle it to death and then it leaves them anyhow. Next is the lack of treatment options really for personality disorders in general, especially BPD. As opposed to schizophrenia or maybe a specific phobia, there are no set goals for treatment for a personality disorder. It is the person themselves. Could be a chemical imbalance, but it's more their way of thinking. It's them as a person. So it's very hard to change everything about a person. Whereas, of course, a phobia, you could just focus on the fear of one thing. Or for schizophrenia, you could just prescribe certain medications to help the situation. Because of this, in the late 70s, there was a professor through Washington State, Marsha Linehan, and she developed, based on cognitive behavioral therapies, what is called the dialectical behavioral treatment. She described it as, "You're perfect, now change." And you'll see in a few moments as I describe it. What this actually means is that as other therapies say, change this about yourself, which is a problem with BPD patients because they see it as a slight and they get offended by it. With this method, you accept them for what they are, flaws and all, and then you work from that standpoint, which really sets it apart from different therapy techniques. It's based on dialectical philosophy, which from the Greeks originated there, and it has a thesis, antithesis, and that equals a synthesis. Everything's made up of two extremes, and it equals to what it is, which really goes hand in hand with the borderline personality, with its duality nature to begin with. And it's saying that, yes, you're good, but you're also bad, and this is who you are. The core concepts of the therapy, borderline personality disorder patients, they're still people. They're doing their best. Yes, the best way to deal with things may not be a suicide attempt or to cut yourself or to just go to one extreme or the other, but as a person, they are working with what they have. Maybe they had issues and this is the best they can deal with it. So as a therapist, you have to realize that. Next is that the patients desire change. They don't want to be what they are. They know that, hopefully they know that they have issues if they're seeking therapy. And they want to become more than what they are. They want to be normal, per se. Another key concept is the acceptance. As a therapist, you have to accept the person, the BPD patient, unconditionally. Yes, you may not like them. Yes, they may have issues, but you still accept them as a person. And let them know that they may not be, you don't have to say good person, but they're still a person, and that means a lot, especially to these people that usually are pushed aside and shunned so much. The last area is mindfulness, and mindfulness refers to staying in this moment, not worrying about what happened last week, not what might happen, what this person said, what they might say. It's this moment right now. What's going on? Focus on that. There's two components to dialectical therapy. The first is the individual component, which unlike most therapies where you go, it's very unstructured, you just talk about whatever. This follows four principles. First, you talk to them about anything that's physically harming them, especially suicidal behavior. You address those issues. Next, you talk about skills and how they're utilizing them. And if they have any questions about this, life skills they're learning, and the group therapy, which we'll just talk about in a second. Third, you address what's going on in their life and how they can apply these skills to their life. And lastly, you address future goals and things that they might want to work on in the upcoming near future. This is very different from most therapies where it's very unstructured. This is a very set, structured core to it. The next is the group therapy component, which borderline personality disorders, of course, have issues with other people. This was included because not only can they develop their social skills, they can develop them with each other and point out things that they might have overlooked otherwise. There's four issues here too that they address. Distress tolerance, which has to do with finding alternatives to dealing with issues as opposed to cutting or burning or suicide attempts, things like that. Next is emotional regulation. Most BPD patients don't actually have good emotional recognition. They know love, they know hate, but they don't know just okay. They don't know the in-betweens, they don't know the shades of gray, they don't know how to feel those. So the therapy helps the patients to understand that as a whole. Next, you have interpersonal effectiveness, which of course helps BPD patients relate to other people and how they might go about things. And finally, you go back to this mindfulness, which I talked about earlier, which is learning how to live in this moment and not the past or future. So the results in the future of this therapy, this is actually the only therapy that has proven results to be effective, or at least making progress towards BPD patients, which makes it highly desirable. The other great thing about this is it's a lot quicker than most therapies. Some individual therapies can take years for a patient to show any sort of progress, where this can just start and it can just take a short few months with some sort of progress, and they can work from there, which of course insurance companies love that idea. They have to spend less money. This also focuses less hospital time. So resources in general are a lot lower with the dialectical therapy approach, which makes it better all around for everyone. So that's dialectical behavioral therapy, and I hope you enjoyed the presentation.